The following presentation was made possible by supporters like you. Consider making an impact today by honoring Science for Georgia with a gift, or by joining our Catalyzer network. Thank you, and enjoy.
Again, my name is Morgan Barnes, and I'm just going to go over the Black Women's Wellness Project with the Center for Black Women's Wellness and some of the work that we have been doing around environmental wellness and environmental justice at CBWW. So feel free to let me know if you have any questions. I will try to see if I see anything in the chat, but of course, stop me if you have any questions.
We'll watch for it, Morgan.
Okay, no problem. Thank you so much. So first, going into who is the Center for Black Women's Wellness and what is our mission and the thing around the work that is being done. So CBWW, our mission is to improve the health and wellness of Black women and their families, as well as the economic health of communities. With a 35-year history, CBWW was born out of recognition and the dual oppression of race and gender, of course, in healthcare. So our goal is to provide medically underserved, low to moderate income adults residing in Metro Atlanta and its surrounding counties, of course, with easy access to quality and no-cost affordable healthcare. CBWW serves over 2,000 women and their families annually in the Atlanta area. So just to give you a little bit of overview of our programs, we have a women's wellness clinic as well as, and in our clinic, we also have what we call a safety net clinic, which focuses on chronic disease prevention and management. We also have community lifestyle education. So through health education programs, we educate individuals and their families on healthy lifestyle behaviors and encourage healthy lifestyle changes, especially when it comes to the prevention and the management of certain diseases. And we have our behavioral health program where we provide mental health services. We partner with Odyssey Family Counseling, as well as we have a psychiatric nurse on staff that is able to see patients for medication management as well as individual therapy. We also have our breast and cervical cancer program, our environmental wellness program, and a vaccine hesitancy program. Through our Atlanta Healthy Start initiative, we case manage pregnant women and infants up to 18 months. And also under this initiative is a fatherhood initiative, and we provide prenatal and postnatal education, also known as Empowerment to Education, or ETE. Our maternal health equity programs focus around advocacy program and policy change, and we also have a women's economic self-sufficiency program that focuses on making sure that women and their families have financial wellness and financial literacy, and we encourage the opportunity or any patients or clients who have the opportunity to start a micro business, we encourage that as well. So this is just a lovely picture of all of our staff members and who is a part of the environmental wellness team. Again, my name is Morgan and my camera is not working today, but here I am right here. And this is the rest of our dynamic team that helps get this project up and running and off the ground. So what is the Black Women's Environmental Health Project? The Black Women's Environmental Health Project is to empower Black mothers to protect the health of their children through enhanced environmental health literacy. It is a multi-level approach to increasing environmental health literacy and decreasing environmental exposures of Black children. Additionally, in 2018, we received funding and support from Emory University and their Children's Environmental Health Research Center to pilot a project or to pilot the program that we now call the Black Women's Environmental Wellness Program. And we talk about how we can combat the environmental exposures that are disproportionately affecting, African-American children in low-income communities. So just a little bit of why do we do this project? What is the purpose? What is the thing, when we have this initiative? So the first thing, that we want to do,
Hey, excuse me, Morgan,
yes.
you're fading in and out. Can you stand a little closer to the mic?
Oh, I'm sorry. Let me pull it.
No worries. Thank you.
You're welcome. Okay, is that more clear?
A little bit?
Okay, I don't know where the mic is on this. I'm just gonna lean in.
All right.
So again, why do we have so for the first
Morgan, we can't hear you at all now.
y'all can't hear me at all? Hello?
That's better. Wherever you were at right there, that was good.
Okay, so maybe the mic is somewhere down here. So again, why do we have this project? What is the purpose of the project, and what is the reason that we're doing this? So numerous studies have documented that environmental justice issues facing low-income and minority communities have resulted in negative health outcomes for children living in those communities. So some of the things that you may be familiar with is like the Superfund site and the lead exposure that was found around, or the lead that was found contaminated in the soil and water in those communities, just in the heart of Atlanta. These issues can include disproportionate exposure to lead, air pollution, violates poor housing, as well as pesticide issues or issues around pesticides that have been used, and environmental injustices that are present in Georgia span from air pollution, food access and quality, water quality issues, hazardous waste sites, polluting plants, and more. And especially as Georgia continues to build up and have construction and have more warehouses being built, have more jobs coming to Atlanta area, the increase in population, all of these things can contribute to chemical exposure. I'm sorry, y'all, I pressed the space button. Did not and accidentally muted myself. So this is the story that the data tells. So just looking at this general, at this overview of this chart, we can see that Black and lower income children are at an increased risk for health or for lead exposures. Stressors related to structural racism impact the health of our communities, things such as redlining that has happened in the past. And this is caused for low-income minority children to be more likely to be exposed to lead and other environmental health issues that impact health and brain development. Oops. So what are our project goals and objectives? What are our project goals and objectives? The infusion of environmental health literacy into current and existing programming. So how can we take this information that is that the staff is learning, and how can we go ahead and infuse that into programs that we're already currently having? When it comes to the type of programming that we have, when it comes to chronic disease management, maternal health and maternal and child health outcomes, even things such as nutrition, women's wellness, and how these exposures can affect your reproductive health and affect the health of your children. We found it to be fairly, I won't say fairly easy, but we found it to be a seamless transition when it came to including this information, because it all goes around full circle when it comes to executing and being able to incorporate this health literacy programming into our current and existing projects. So in addition to infusing it into current programming, we also wanted to do a social media campaign where we're able to provide this additional information and provide an environmental health and social media campaign to provide culturally appealing environmental health messaging to Black women through social media platforms. So we want to make sure that this information is received well. We want to make sure that this information not only is being received well, but could potentially be being incorporated into their day-to-day lives, or at minimum, we want them to be able to have the information and take this information and incorporate and make small changes in their day-to-day lives. Additionally, the project goal, we wanted to make sure we include a train the trainer module where we're able to train other organizations and provide education to other organizations and community partners so that they can then relay this information to their community partners as well. Or I'm sorry, to their patients and clients that they serve also. And then lastly, the integration of environmental justice and environmental racism in outreach programming. So what are some things that we're doing to try to get this information out there? One of those things include breaking the silos, identifying key stakeholders, and how can we collaborate with different agencies and organizations to have a larger reach, to have a stronger reach. So one of the things that we ended up doing was creating collaboration between federal agencies and community-based organizations, and as well as through educational institutions. So we're working with Emory School of Nursing through their charter program, which is associated with the PACU for the Pediatric Environmental Health Specialty Unit, as well as the community organization piece of CBWW. So this is just a timeline of how CBWW kind of connected the dots and was able to bring this project to life. So working with Emory through their Children's Environmental Health Research Center is one section of the project, while also trying to incorporate this education and information into our community action network, which is a large variety of community organizations that meet monthly, where we're able to connect with them and share information and resources about the project and about other CBWW initiatives as well. And then from there, we were able to incorporate this project into our Magic Milk Mommies, which is our breastfeeding support group for our patients or for our clients that are a part of the Atlanta Healthy Start program, which then led to the environmental wellness entire project and initiative, which is what we are discussing today. And then also, how can we continue this work and how can we allow this work to continue as we continue to grow, as this program continues to grow. So I'm trying to move there we go. Okay, so what are some ways that we can work together, and what are some ways that we can identify those silos, or that we can break those silos? So one of the things that we were able to build off of was the ATSDR's principles of community engagement. So just some of the overall takeaways from this includes being clear about the purpose and the goals that we set, being knowledgeable about the community's culture and learning about the community's perception. So when you are able to, join in and you're able to work with these community organizations, especially from a federal standpoint, sometimes the community does not receive that well. So when you already are working with someone who is engulfed into the culture, and the community, then you're able to learn more about the community's perceptions. And also it makes it a little bit easier to establish those relationships and to build trust within the community. Another thing is partnering with the community is necessary to create change and improve health. So it is not as helpful if we are going into the community with the idea in our head of what they need without initially even talking to them to understand and identify their needs. So also, with that being said, when you're able to work with the community to create, or work with the community to identify their needs, it makes it more seamless to transition into identifying solutions that create change and improve health. You also want to respect the diversity of the community. And also moving into community engagement, we want to make sure that this can be sustained by identifying and again, mobilizing those community strengths, understanding what their needs are, and also understanding their capacity and their resources that they currently have, so that when you're thinking of solutions and making decisions to take action, you can include that into how you're going to take that action. And also, you want to be able to engage in that community and be prepared to release control of action. So sometimes it's okay to be flexible to meet the changing need, because our communities are changing, information is changing, we learn more information every day, and we want to be able to be flexible enough to meet, again, those changing needs. And then lastly, community collaboration does in fact require a long-term commitment. So we don't want to expect that, in 6 weeks, with 6 weeks of health education maybe, or one webinar or one lunch and learn, that the patients and the clients are going to take that information and now they're going to make all of these changes and do all these amazing things, when we know that in reality, repetition is important. And so we know that that long-term commitments are able to have a more impactful change and a more impactful journey when it comes to making those changes and engaging and breaking those silos. So this is just an example of one of the focus groups and that we were able, or one of the forms that we were able to give to a focus group, so we can understand what are they worried about, what are they looking for, what are they more interested in when it comes to keeping their family safe. And some of the survey group results included food safety, safe cleaning products, health and beauty products, as well as air pollution. So those are the things that were the most important for you and your family, for them and their family's health when we participated in this focus group. And this is just another example of some of the things that we have, some of the resources that we have provided to our patients. So we work to create a health screener. And what that health screener does is identify the needs and concerns of the patients and the community members. And based off of the answers that they input and the results of their screener, they would then receive a prescription for a position, or a prescription for prevention. With the prescription for prevention, it provides some, hopefully you can see my clicker. It provides information around various topics. So this is an example of personal care products. It also provides resources on how you can learn more about those products, how you can learn more about cosmetic ingredients, in this example, and safety. And it also includes a toll-free number where you can call to get more information and speak to a member of the PACU or a subject matter expert. And these prescriptions for prevention are also displayed on the monitors, kind of on like a photo loop in our clinic. So integrating environmental health literacy into the programs. How did we do this? What programs did we try to integrate this information into? And this is an example in this photo of an environmental wellness kit that we have given to community members at our health fair. Inside the kit includes eco-friendly health and beauty products, eco-friendly cleaning products, and we also give them a bag so that they're able to carry those products around and take them home, a reusable bag. So we integrated these environmental health literacy into staff trainings. We also included it in our home visitation program through our Atlanta Healthy Start program that case manages those pregnant women and their infants. We included this information in our Magic Milk Mommies cohorts, as well as in our Empowerment to Education classes, because again, we know that these environmental health exposures not only affect the development of children, or the development of the children's brains and behaviors, but it also it can affect your reproductive health as well. So that's why we include that in those prenatal and postnatal classes. We also included it into our wellness clinic operation. So again, putting that information on displays and monitors in the clinic, as well as community outreach and events and health education. So we'll host webinars. We will host mostly online webinars, and then we also would give out information and education at community outreach events. And this is just another example of some of our social media campaigns. So we want to be able to disseminate culturally relevant and easily digestible information that addresses the main things that our focus group showed that people were concerned about. So clean eating, mold in the home, lead exposure, developmental impacts, reducing your risk of exposure to toxic chemicals. We try to have information and messages on our social media through LinkedIn's, Facebook, and Instagram on these different things. And you can even now, this is just an example of something that was posted on Facebook. You can scroll through our Instagram and see that we have various posts and various graphics that talk about the different types of exposures and reducing your risk, and some best practices as well. And this is an example of one of our Train the Trainer workshops where we collaborated together. It was a hybrid workshop where we did have some people on Zoom. And this is just one way that we started trying to break those silos, encourage partnership, bring together all the key stakeholders into a room, and as well as with community organizations, so that we can talk about the best practices and best ways that we can incorporate this environmental health information into our current program, and what is the best way to do so. And this is just some examples of pictures and photos that we had, where we are able to where we have given out information and had connected the community to resources. So for example, in this top right or top left photo, we have Nathan, one of the people that we work with on the Emory team, who brought some clean vegetables, talked about the dirty dozen and the clean 15, and really was able to get that messaging out to the community. Here we are again, giving out those environmental wellness kits. At this particular day event, we were able to partner with Brita, and they were able to donate some pitchers where there were some filtered water pitchers that we could give out to the community. Right here, we also talk about small home gardens, and we were able to give out some seedlings through our community health fair for families, and even during the height of COVID, we even started off this project started off one of these community events by doing a drive-by or a drive-through community Earth Day event, where we were able to give out some air purifiers and just pop those in those individuals' trunk, moving on and just working with community organizations and families to bring all of this information together, or bring this project to life. And so that concludes the presentation that I have for today. Y'all feel free to let me know if you have any questions. I'm gonna stop sharing. Well, and this is my contact information here. I'm gonna stop sharing my screen so that I can see if anyone has any questions. But if there's anything that we may want to revisit, of course, you all feel free to let me know. And I hope y'all are still hearing me okay. All right, awesome. So thank you, everyone. And again, if you have any questions, please feel free to let me know. I'm happy to answer them.
Yeah, thank you, Morgan. Super great. Really appreciate you coming online. Huge round of applause for Morgan, who's having technical issues with her computer. So
yes, thank you. Maybe it'll let me, let's see if it wants to participate.
Yeah, we know how beautiful you are. So you're almost there. So it's like Morgan in the witness protection program.
Right.
I don't
Yes. Oh, okay. I might.
Oh, yay.
Very briefly, but
now
this is me.
That's Morgan. I'm super grateful
like
that
that.
she could make it today and give this presentation. So, but I do want to welcome people if they have questions to either, raise their hand and we'll ask you to unmute, or just plop them in the chat and we'll read them out loud to Morgan. But I am gonna popcorn it over to Karen because I know she has a question.
Hi, Morgan. Thank you so much for joining us today. I truly appreciate it. But before we get started with any more questions, I have a question. What are some prevalent health disparities evident within the African American community?
We lost half your question, Karen.
Oh, you did? Can you hear me again?
Yes.
Okay. So I said, what are some, excuse me, what are some prevalent health disparities evident within the African American community, in Georgia specifically? I don't know if Morgan heard me.
I don't know. That might have been the last gasp for her computer. We'll find out.
I'm so sorry. I'm thinking that I am unmuted, but it's my camera that is trying to have issues. So can you repeat your question one more time, Ms. Karen? Yeah, no worries. So I asked, what are some prevalent health disparities evident within the African American community in Georgia? Specifically. Oh, okay. So some that are the most prevalent, and honestly what many of our initiatives that are based upon include, for example, definitely breast cancer rates, breast health mortality rates that are surrounding Black women in Georgia, specifically that Black women are a couple times more likely to be diagnosed with breast cancer at a younger age, as well as face mortality and have that a more stronger type of breast cancer, also known as triple negative breast cancer. Without getting into all of the nitty gritty of it, that is one initiative, or that's one problem that we notice that's in the community. Another issue that we know that is prevalent and still prevalent, of course, are our Black maternal health outcomes that we currently are facing. How Black women in Georgia are about 4 times more likely to potentially die during childbirth, regardless of their background, regardless of their socioeconomic status. It's just something that is currently is a hot topic right now. It's being talked about a lot. If you notice that is something that has been a hot topic of conversation for many organizations, especially organizations that support women. Additionally, other issues that we know that are still facing our community, of course, are chronic disease issues. So diabetes, pre-diabetes, high blood pressure, hypertension, especially when it comes to Black women, because they seem to be more likely to be a little bit more at risk for having higher stress levels, mental health, things surrounding mental health at this time, anxiety, even going into understanding postpartum depression a little bit more. All of these things we know that are currently affecting the clients that we serve. And those are just a few. And of course, now that we have had this Black Women's Environmental Health Project, we're learning that there are even more disparities that affect disadvantaged communities, such as being more likely to be exposed to lead, such as being more likely to be exposed to environmental health exposures, and have those exposures affect the health of your children. So it's a lot of different things that we are trying to have initiatives around, but we are a small but mighty team. However, those are just a few of the things that we are currently very much involved in, and as well as cervical health. So we have a breast and cervical health program, especially with all of the information that's coming out around like chemical straighteners and how it's affecting cervical and ovarian cancer and all of those different things. So I hope that answered your question. It did. Thank you so much.
Yeah, I see Tanya raised her hand.
Yes, thank you. Guess good afternoon or good morning. I actually serve on the executive committee for the Centennial Club, and I have one of my other members, Betty Harris, on as well. For Sierra Club, we represent Cobb Cherokee and North Fulton. And I'm also on the Social Action Committee for the Marietta Roswell Alumni Chapter of Delta Sigma Theta, which also serves the same area. So I guess my question is, does your organization do any policy work with our state legislators or local legislators? And if so, what should we be focused on as it relates to that, especially going into this new session? And is there any areas in Metro Atlanta that you see that are maybe hot spots?
Yes, so we do some policy work. We more so okay. So we currently have a fairly new initiative, so to speak, where we focus on not only under our maternal health child health umbrella. So we have a maternal health equity team, and one of their main focuses is really getting advocacy trainings that are going on for individuals, for organizations, and for healthcare providers. So where they are educating and they're providing these different trainings where they're able to talk to our community members, talk to our patients and partners about what are things that we can do to get the attention of our legislators, and how can we go about doing that. And fortunately, this actually comes at a good time, because one thing that is recent or is going to take place soon or at the end of the month is that Nathan, who we work with and probably is one of our CBWW staff members, I'm unfortunately unable to attend, but we will be in Washington, D.C., where they'll be able to talk to policymakers and talk to people basically on Capitol Hill about environmental wellness, environmental justice. And Nathan is going there representing Charter, but he really wants for one of CBWW's members or staff members to join so that they can further drive the message to those policymakers and to those main people who are making these laws that says, hey, this is the actual issue. This is something that's being talked about. This is what we're doing to try to create change, but these are some of the laws that we need in place to help do so. So we're trying to get there. We're getting started, taking baby steps, but policy change and advocacy is definitely something that we are looking to get more involved in and looking for the best ways that we're able to get involved in that. So hope that answered your question, Ms. Hahn. Yeah.
Yes, it did. Thank you so much. And Nathan's great. He's going to be speaking at our October panel. So that's
yes,
great.
Nathan is
I'd love
awesome.
to hear that.
Oh, I see another person named Free have a question, so feel free to open up.
I actually don't have a question. I thought that was a great segue. I think Amy Sharma, as well as Andrew Young, knows exactly what I'm getting ready to say. And so we actually have a convening coming up September 26th we'll have several community organizations as well as community members coming together to pretty much advocate for EJ law in the state of Georgia. And we would love to invite all of you to come out. I have Morgan, I sent you an email this morning with more details.
Yes.
Yep.
Okay.
And then also, Ms. Robinson, I just sent you a message in the chat, and I would love to send you more details via email as well. I'll drop my email in the chat, excuse me, if anyone else is interested.
Thanks for that great plug, Free. I was going to do it if you didn't. So very excited about, yes, the upcoming, there's multiple EJ bills floating around the Georgia General Assembly. So we're working on kind of solidifying some messaging around it and making a concerted push. So it's going to be very excited. Does anyone have any other questions?
I do. I have one more question. So Morgan, I know I was looking at your slide and you definitely have like great train the trainer and initiative that you and your organization are doing. Maybe can you share any success stories or examples of positive change resulting from the organization's previous work on the environmental health wellness?
Yeah, absolutely. So hold on, let me lean in. Okay, absolutely. So one thing that some of the things that, we consider to be successes definitely include number one, the growth and expansion of the program. I'll be the first one to tell everyone this program came at a crazy time because we received the funding, I believe, at the end of 2019, and then in 2020 was when we implemented the project. But of course, March 2020, COVID took over, everything went remote, and that was when we really took the chance for the staff to get trained and learn so much about environmental health and wellness and environmental justice and just all of these different things that even with my being in public health for, I don't know, 6-7 years at that time, things that were not on my radar, but that affected the community. So that was that. And then also, I tell people this all the time, I also was pregnant during that time. So everything that I was receiving was, I was taking it in tenfold because it directly affected me. So with that being said, the growth of the program, how the staff has consumed so much knowledge over the course of 3 years, how we've been able to get continued funding for this project. So the first 3 sites, we were able to do it for the first 3 years of the grant, and then we turned around and were able to expand the funding until I believe 2025 currently. Also, again, the first 2020 was an entire year full of COVID and uncertainty where we didn't know what was going on. And then in 2021, that's when we started doing our Earth Day celebration. So we've had 2020, we've had 3 of those so far, and they've grown. Somebody knocking at my door. That we've had 3 of those so far, and they have grown tremendously. From the first one started as a drive-by health fair or a drive-by Earth Day fair when we were standing out the building, where we couldn't even get into the building at that time. And then also now to where the second year we were able to. Sorry, y'all. I've just moved and they're dropping off the way. Give me 1 second. You come in? Yeah, you come in. Sorry, y'all. I apologize, but yeah. So the expansion of the, and then on top of us being able to incorporate this into our health fairs, our annual community health fairs, we have in November where we've been able to give out environmental health products, give out things such as eco-friendly cleaning products, laundry detergent, and prescriptions to prevention. And then also lastly, one of the things that I feel like is most important is the fact that people are actually taking the information and taking the products that we're giving them and incorporating it into their day-to-day lives. So for example, oh wait, y'all can't hear me. Hello. Is that better?
Yeah, you're back now.
Okay, let me go sit down. But yeah, so one of the things that I think is one of the most important is the fact that we have had clients that have said that, ever since you've given us these products, I have seen them at my local Target, Kroger, Walmart, and I've been able to purchase those products and I started incorporating them into my day-to-day life. For example, my best friend, she has 3 small children under 7, and she said ever since I started giving her like the eco-friendly cleaning products, it makes her feel a lot better that she knows, since 2 of her kids like to put things in their mouth all the time, she knows that they're not getting any additional chemicals that might be unnecessary for them. So that's just, and she has a small dog, so everything is just a little bit safer for her. So that is what I think are some great successes just since the start of the program. And I hope that we continue to have those successes as well, or have more successes.
Awesome. Thanks, Morgan. Thank you so much. I actually have a question. So you've mentioned like a ton of things you guys are working on, and sometimes I feel that when we look at these problems, there's like so many that we just get overwhelmed and we just want to like quit. So if there's just like, if you could wave a magic wand and pick one thing, or if you could be like, hey, everyone on this, I know it's like a million things that we could be doing better at, but try this one thing first. Like, what would you recommend the audience do like today, or what would you wave a magic wand to fix first?
Oh, Good question. So I think that one of the best things that we can do is not stop having these conversations. I think that it's important that we bring this information to not only those who we work with, but have these conversations with people in your personal life. Have these conversations with your family. Have these conversations with your friends. And I'm not saying, we have to be presenting peer-based articles at the dinner table, but it's just a nice conversation. Like, oh, maybe you have children. They might say, Mom, you used to buy Dawn. Why do you buy this Myers cleaner now? And it's just a simple of, I like their ingredients better, or, they're safer for you, or something like that. And then, they can take it and they might tell their friends or I was my mom is somebody who loves science, or in my case, a science nerd like myself. And they were telling me this, that, especially when it's coming from a trusted source. People just receive that information a lot better. So my so my takeaway is definitely continue to have these conversations so that they don't fall off the radar. Like I was saying earlier, in public health since 2014, 2015. And it wasn't until like 2020 where I had heard these terms such as environmental justice and how these different things were affecting the communities that we live in. I didn't, when I thought about environmental wellness and environmental health, I always had a mindset of like health and occupational standards, or climate change, or global warming, all of those different things that I didn't think that I could make that much of an impact on, besides maybe like, recycling, or something along those lines. But really seeing that, no, there's more that we can do, and there's different ways that we can come together. So that's just my 22 cents. That was more than 2 cents. That's just my 22 cents on that particular question as well.
I absolutely love it. Thank you so much. Also, peer-reviewed dinner discussions do also happen in my house too, in case anyone was feeling a little dorky, but I totally understand. Yeah, that doesn't work so well in other places. So yeah, I love it. Keep the expression, or keep the conversation going, and spreading awareness is perfect. So it looks like we have time for about one more question. Does anyone have a question? Otherwise, I know Karen has like 5. Betty, you've come off mute. Do you have a question? We can't hear you, Betty, if you're speaking. Okay. No question for Betty. If you have it, you can type it in the chat. We'll go for it. But Karen, did you have one last question?
I do. So my last question is, how can individual or other organization can contribute or collaborate with the Center for Black Women's Wellness and Advancing Environmental Wellness initiatives? Partner up with other organizations. How can we go about doing that?
Awesome question. So one thing that I always recommend, of course, is around the events. Then we always are willing to accept volunteers. Another way that we can work together is if you or if any communities or organizations have those who are in health education or subject matter experts or things of that nature who are interested in collaborating and doing webinars with us, or classes, or even in-person events. We're always happy to have those type of events and introduce our community and the patients and clients that we serve to those different organizations, so that they're comfortable knowing that, this is another organization who we work with. This is, again, a trusted resource or a trusted source of information, so that they're able to receive even more information, because, we'll be the first to admit that we have been learning as we've been going, and we have been taking in all of this information. So it's always good to bring in other experts who can go and talk about various topics, and talk about various different things that we are currently doing. So that is definitely one way. And also, we also like to share resources. So if For example, if somebody reaches out to us and they have some environmental wellness questions that I just might not have the answer to, being able to reach out, it's always a pleasure to be able to reach out to Nathan at Emory or Abby or Amy or Patrick to say, he's asking about XYZ. I know that y'all recently might have been on this or something like that. Can you provide them with more resources? And that's also something that, we like to be able to do, to work together, to actually collaborate and put our minds together and put our heads together.
Yay, thank you. Okay. So I want to thank everyone for coming to this amazing discussion. Does anyone have any final questions? Okay. If you have any additional questions, please reach out to any of us and we'll be happy to take care of them or answer your questions or connect with you. Just for a little bit of clarification, I'm Amy Sharma. I'm the Executive Director of Science for Georgia. We worked with the Center for Black Women's Wellness and Dogwood Alliance and Emory Charter on the Environmental Justice and Climate Protection Conference this summer. And I want to give a big shout out to Karen and also her fellow intern Mallory, who came up with this idea of having some follow-on fireside chats so we could have further discussions with some of the programs that presented. And super excited that you all could join us. I believe we have a few more coming up. We should have actually 3 more coming up after this. So watch your email and watch the internet, and we'll have more events after this. And this, we will get the recording of this up on the internet shortly so you can share with your friends. But thank you everyone for coming. We 100% appreciate this, and have a great day.
Thank you. Everyone have a great day. And I also put my email in the chat in case anyone would like to reach out. So just let me know if y'all have any questions in the meantime.
Yeah, and thank you so much, Morgan.
Thank you so much for having us. Y'all have a great day.
You too.
Thanks you all for coming out.
Appreciate it.
We hope you enjoyed this presentation. For more information on Science for Georgia's mission and our past work, visit our website at scienceforgeorgia.org.